hearing aid is a device that's primarily designed to improve clarity of speech in background noise or even in quiet. They come in a variety of styles. They can sit behind the ear, they can sit in the ear, and the technology of them has really come a long way in the past 5 to 10 years. They can come rechargeable, so it removes that hassle of having to change a battery. And they also connect to your cell phone, so things like phone calls, music, podcasts, or even audiobooks can stream directly into the ears. And this here is the behind the ear style. It's a small piece that sits back behind the ear, and then there's a small bud that sits down into the ear canal, and this is the area where the sound is transmitted into the ear canal. The ones that typically benefit the most are ones that notice they have difficulty understanding in background noise or in the quiet when talking to a spouse, significant other, family member, or friend is when they really notice it and they're a really good candidate for hearing aids. Also, anyone who has tried hearing aids in the past or are current users has found that newer devices has really advanced in how well they're able to reduce background noise and improve speech clarity. For hearing aids, age is all ranges from babies, newborns, to older ages. Hearing aids can help anyone in those difficult situations, especially babies or older patients. The hearing aid consultation or fitting appointment, we start off by talking about the hearing test and helping the patient understand their hearing test and what it looks like and why they may be experiencing some of the difficulties they may have. And being able to really focus in on what they tell us helps us to be able to pick the technology and device that would be the most beneficial for them, but also making sure they're not overspending, but still being able to select something that's appropriate for their needs. At this appointment, we also set a pair of hearing aids to the hearing test that we've done for them, so they get a feeling of what hearing aids will feel like and sound like in the office. And we always recommend a family member or a loved one to come to that appointment so they have a familiar voice to listen to. So when a patient gets hearing aids, they begin to hear sounds all around them that they probably haven't heard in many years. Some get excited to hear the birds chirp again, or hear their children speak to them clearly, or their grandkids laughs again. You see them walk in with these big smiles on their faces that they didn't have first when they had walked in the office. So a lot of the time my patients come in reluctant about the size of a hearing aid, but with the technology advances, they're able to get all this power and all this sound into something so tiny. They come in thinking it's going to be this big, bulky device that sits behind their ears, something that, their grandparents or their parents' parents have worn years ago, but that's not what the technology is anymore. They're so small that they actually just sit right behind the ear and they disappear right behind the hair or the ear so that they're not even noticeable anymore. And with the technology advances, they can, with the streaming of the phone calls, it's almost like a pair of earbuds that are just helping you hear so much better, especially in those difficult listening situations. With hearing loss, having conversations and following along with what's being said can get really difficult, especially with that loss of clarity of speech. But with hearing aids, they feel comfortable to get back into those family gatherings and hold those conversations and get back out going with their friends at noisy restaurants, and they don't have to be afraid of not understanding what the conversation is and having to pull away from those environments. And so hearing aids can help really improve those situations and help quality of life a lot.